Okay, welcome everyone and hello. Thank you for joining this session. The session is recorded, so please be aware of that. If you're not speaking, if you could turn your camera off, and there will be an opportunity for questions and answers at the end. So welcome everyone to our Healthy Minds webinar series. The aim of these sessions has been to improve the way we deliver our services to promote better lives and respect the rights of people who live with mental health issues. Those are cornerstones of our mental health strategy that we launched last week, and it's really important in terms of how we improve people's lives, how we respect their rights, and how we deliver the best support that's available. My name is Sasha Butt. I'm the Priority Director for Healthy Minds, and I'll be your host today. So, as I said, the focus of these webinar series has been to raise awareness of the month of fasting, Ramadan, and how we can impact people who have serious mental illness and how we support both them and their families to have a good Ramadan. We recognise how this is a key pillar for people in terms of their faith, but also how practitioners really want to be able to support people well and how we can improve their skills and confidence to do this. And that's been the focus of these webinar series. We started in October last year. The first one covered the just basic awareness and promotion of the webinars and inviting people to learn more about Ramadan, about the impact on mental well-being and some of the services that are available and support that's available. The second session that we had, which was then in December, really focused in on the clinical support that's provided for people and the planning that takes place. And much of that was, again, through that understanding that we gained from session one about why we need to do this early and the impact and the outcomes that we can achieve for people. The third session, which took place in January, was on then the psychological and emotional support for people. So all three of those webinars are available on our website at www.bdcpartnership.co.uk, and you can take a look at the webinars themselves and some of the resources that are shared there. This whole series has been a partnership with the British Islamic Medical Association, who've kindly supported and given their expertise to design these services in the way that these webinars in the way that we have. And today's webinar very much is going to focus on how on the community support that's available, the support for carers, and how we emotionally support people through the month. So I'm going to invite my colleagues to introduce themselves. I'm joined by colleagues who are going to talk about the work that they do and how they've been supporting people and the importance of support during this month. And they're from Making Space, which is one of our mental health partners, delivering support for severe mental illness and carers who experience that, and Carers Resource, who's our district-wide organisation providing support for carers and families. So can I ask Jane and others to introduce themselves? We'll go around the screen.
Hi, good afternoon, everybody. My name is Jane Trofer, and I am the Making Space carer support worker based at Somerset House, the adult community mental health team in Shipley. And I'm going to be doing a little bit of an overview of our service when we get started. I will just say, though, that our colleague Nazreen, who was going to discuss about Ramadan, she has her slides included in this. She's not able to attend because of a sudden family bereavement. So myself and Mary, we will do our best to interpret her slides, and hopefully we'll be able to get the message across, and the way that we work in that way. We'll be doing it a little bit of a joint tag team thing, so we can hopefully cover everything. But please do feel free to ask us any questions at the end. Thank you.
Hi, yeah, I'm Mary Womersley, and I'm also a support worker at Making Space, supporting families and carers who are caring for somebody else who have mental health issues. I'm based at the CMHT in Field Business Centre, South and West team in Bradford, supporting supporting them on one-to-one, and we'll go through the slides in a few moments. So yeah, again, me and Jane are going to actually support each other in unfortunately Nasreen's absence. So yeah, just bear with us. Nasreen is the expert, but we are aware of a lot of what she's put in, and we've had discussions about it. Okay.
Thank you, Mary.
Hi everyone, I'm Helen Prince. I'm the head of young carers and families at Carers Resource. So I'll be speaking from the perspective of supporting young carers of people with SMI during Ramadan. And my colleague Rachel's joining us, who's...
Yeah. My name's Rachel Waddington. I'm the interim head of operations for Bradford District. So yeah, we'll just give an overview of Carers Resource, and then Helen and I, like Jane and Mary, are doing a bit of a tag team.
Brilliant. Thank you. Thank you. Natasha, can you move to the next slide, please? So probably just want to give a bit of overview. As I mentioned, we launched our mental health strategy last week, and we have 3 big ambitions that we've co-produced with our communities, with our frontline staff and with carers, which are very much about how we improve better lives for everyone who lives across our district. And that's making sure that they have the same opportunities that anybody else has, that they can live fulfilled lives and access opportunities in terms of work, education and social activity as anyone else can. We also recognise that people who have mental illness sometimes have their rights curtailed, and actually we really want to focus on how we reduce the inequalities that people face, and that very much stems from how we respect the rights of people to have informed choice, to understand their rights, and also to be protected and safe in the way that our services are delivered. And then the third ambition that we have is around improving the support that we deliver to people, and that's in terms of our frontline services, our community services, that we work together and how we integrate and ensure people have access, that they have tailored support, and that we really recognise and understand the needs of our communities in the way that we provide that support. So those are our big 3 ambitions, and in doing all of that, how we work as a system, as an integrated team, is acting as one, and that's about how we all come together with the different skills, abilities to achieve those aims for our communities. Should we move on to the next slide, please? So I've done a bit of a recap of webinars 1, 2 and 3. I mentioned that they're available on our website, but they're just on that slide. It tells you that webinar 1 focused on that preparation, why Muslims fast, that early information about the importance of this month, and how we provide that. Webinar 2 was about the clinical management, and actually the clinical skills that both clinicians, whether that's medical, pharmaceutical, social work, or our psychological services provide in terms of their preparation and supporting for people. And then the third really focused in on that psychological support. So like I said, today's webinar will look at the role of carers in the community, and how we support people with a serious or severe mental illness, which we sometimes abbreviate to SMI, and we'll hear from Making Space and Carers Resource in terms of the work that they do. And we might, if we have time, also talk about how we support staff through this as well. So that might come in, and then invite questions from everyone. So if I ask Jane and Mary to start with theirs first. You're on mute, Jane.
That's a good way to start. So can't hear what I'm saying. I'm just going to give a quick overview of about Making Space for those that may not know who we are and what we do. So I hope that's okay. And then we'll go into how we work with carers through Ramadan. So we've been around for quite a long time, actually, and this is what we're a mental health carer support service across Bradford and Airedale. We're all based in the adult community mental health teams, and our service is to provide support to carers of adults with a serious mental illness, so that we can support those carers to have more choice and control over their own lives. And we provide them with practical and emotional support that includes their own physical and mental well-being. We work on a caseload basis, so we can work with carers quite long-term as well. It can be a short piece of work, or it can go into up to 6 months and even beyond that if necessary. Could we go to the next slide, please? So in our service, we're not a huge service, but we have seven of us. So and we work predominantly only in mental health, but we are aware of the other services that are around in Bradford and Airedale. So we have three BME workers that are based in the adult community mental health teams across Bradford and Airedale, and the rest of us, we're also spread out. So we are based in Bradford City, Bradford North, South and West, and at Meridian over in Airedale. And we our role is to get to know our carers as individuals. We work in a very person-centred way, so that we can capture the most useful one-to-one support that they need, what's going on in their life, but also the impact caring is having on them. We work in partnership with Bradford District Care Foundation Trust and other local organisations. Our main role is to support the carer and their wellbeing, but we support them to be included and considered in the service planning and implementation of any support plan of their loved one with a serious mental illness. So being in the adult community mental health teams helps us to be able to work in a more collaborative, multidisciplinary approach, so that carers' needs are kept up. You know, the carer profile is raised up there in any discussions and any service planning and support plans that are going on, and also to help carers have a voice as well in their loved ones' support plan, delivery of service, but also within the care trust as well, and delivery of services. So as well as one-to-one, we also provide the above, which you can see. We do groups, coffee groups, we have an Asian women group, craft group, stalls in the park, to encourage carers to meet other carers as well and have peer support, as well as the one-to-one from ourselves. We do workshops, respite. As you can see, these are some of the things that we do, which are carer-led as well. We do things that carers would find the most beneficial to their well-being. So this is where I was going to stop talking, and Nasreen was going to take over. So me and Mary are going to try and understand her slides and decipher them, really. So she's put the you know, the role of a carer, which most people will know, is that they do an awful lot of stuff, 365 days of the year, 7 days a week, in supporting their relative. And as with any carer, these are the things that they would do through the year, but in particular for carers through Ramadan, these things intensify because of everything that is incorporated in Ramadan, and so that they may find that, you know, that while there will be extra work in preparation, more pressure it can be put on them. The impact of all the extra work that they do through Ramadan, you know, as I say, the preparation, the spiritual time that's required, you know, the prayers that they would want to do, but also lack of sleep as well, but they still have to do all of these things. So can I just go to the next slide? So when we're working with carers through Ramadan, as we would with any carer who has a particular faith or spirituality, we're aware of when it's going to be, and so and we know that there can be difficulties around this time. So we would do some pre-planning, I guess, if that would be the right word, of what would be useful for them what additional support and help they might feel that they need as Ramadan approaches, not just for themselves, but also for their relative, particularly if there's going to be some changes because of the fasting, particularly that would be maybe one of the issues of medication in that time, but that we would try and work with them how they best would like us to support them as well. So that could be in that we change. We might not do visits. We may step back a bit if that's what they would like us to do. We might be more phone call based, but carers know how to get hold of us, and we would try and work around what would be the best time for them with everything that they've got to do, in addition with the extra things that are going on in their lives around Ramadan. We do have regular, like say, coffee group. An example would be if we have coffee groups in Ramadan, that might not take place, but what we might do as an alternative is maybe do a walk. So the workers would meet with their carers so that they would have that opportunity to talk about Ramadan, about the prayers, what's going on for them through a walk rather than meeting in a coffee shop. So we would try and do that. We would also be mindful of Ramadan and not do some things so that they were not excluded. So we might be careful in our planning so that everybody would be able to attend if there was something particular that we were trying to do for carers that they wanted to do. And if there were any concerns that were taking place, we would be able to support them with the services. Because we are based in the adult community mental health teams, we would be liaising with the care coordinator. We would be looking at maybe support plans around out of hours. If they were on the wards, we would liaise with the wards as well, if that is something that they would like us to do. So we would try to be very proactive in working with what resources are there, how we can keep that support needs for the carer and their relative through Ramadan as well, and mediate accordingly for them. But forward planning and discussion is something that we definitely would do, and look at what options were available. Not everybody is able to fast for different reasons, but we would also try to support people to think about the other things that they could do that weren't just around the fasting as well. And if we had to link in with maybe it used to be called the chaplaincy service, if they were on the ward, we would try to think about different support coming from there as well. It's now called the spiritual, pastoral and religious care team. Sorry, I did have to look that up because it's abbreviated with initials. But no, we would be very proactive in trying to look at how we could best support our carers as they care for their loved one with a serious mental illness. Mary, is there anything you wanted to add to that?
Yeah, also about the mental health hospitals. A lot of people that are very unwell mentally, and they're in, like for instance, in Bradford, it's Linfield Mount. A lot of people are exempt if they're taking medication. However, a lot of people still want to be part of the fasting, and so they will try the best with a discussion with the psychiatrist, the patient, and always, and the families as well, because it might be, because the medication might be taken at a different time. It might be medication that they could miss at a certain time. So there'll be a discussion about that. But even though they may still want, obviously, the prayer, they're given a room that they can pray in. And that some families take food, they are able to take food up to the hospital and leave it in with them on the ward, and they will pop it in the fridge and then give it to them, and whatever time it is they open their fast. And just one other thing as well about the service users. We don't support the service users, but we have an invested interest in them, because if they're doing okay, so's the carer. And one of the things that, like for instance, Zainab has a mother who supports her son through his mental health, but he's also a substance misuser. And sometimes during Ramadan, he has attended the family home at 2 and 3 and 4 in the morning, which breaks her sleep, which affects her. So then what we may do is have a multi-agency meeting with the care coordinator around her son's mental health, and the drug and alcohol team, who are also involved with her son, to look at ways that we can try to put something in place and plan something so that hopefully that he doesn't do that. So there might be different ways of looking at that. He might have to, there might be something wrong with his sleeping pattern. So we often do have a discussion as a multi-agency team. Whoever's involved with the family and the service user, it's always good to plan a meeting in order for us we're all wanting a good outcome from this. So we're all working from the same page. And during Ramadan, sometimes because the pressure is so much on the carer, even more, and it is for 30 days. And it's a happy time for people, and they want to do this, and they look at the prayers. That it's very, very important. So if that's broken in some way, they're not going to get the full benefit of the Ramadan. So we try our best with planning to hopefully make it so that it can run smoothly. So we look at, like Jane said, it's a personal centered approach. We try to do as much as we can, even if it might mean that we have to signpost and actually refer them to other services that we couldn't help with. So it is important, especially during Ramadan, but it is important all year that we support them in their main issues, and which is particularly more prevalent and worse for them because of the preparation and the what happens around Ramadan.
Yeah, supporting, people's faith and their spirituality is an integral part of who that person is, and so we would, work very hard, whoever the carer would be, to make sure that element in their life is always at the forefront, because faith is a very personal thing, isn't it? And it's a way that people choose to live, and so we would incorporate as much support as we could. And as Mary said, we're not all experts, and there are people out there that would be maybe more appropriate and more useful, but that it's about that we make sure that people are supported with their faith. It's very, very important. I think we've sort of covered, I think this is the sort of thing that Nazreen was going to talk about, how carers would be supported. We've touched about the walks.
Thank you, Jane.
Is that okay?
Yeah, no,
so people can say, yeah.
As I was saying, just as we were just before the introductions happened, I think what's really come through is how, as an organisation and as a team, you're working together with services, that you're taking into account people's individual needs, and how that's not just your staff who are from an ethnic minority background doing that. It's something that you as a whole organisation are doing, and I think that's really refreshing to see that happening, and that shared responsibility that you all take. It's just really important that we all do this, and we continue to learn what further things can be added, and what further things we might hear from some of our members who are in the audience today, as to what additional things we could build in to continue to support both carers and as you said, carers are well when the people that they care for are well. So it's in everyone's interest to do that well. Shall I invite Rachel and Helen to present, and then we can go to some questions, and hopefully people are thinking of questions or suggestions and comments that they can put in the chat.
Yeah, hi. As I said earlier, I'm Rachel Waddington, the Interim Head of Operations for Bradford District for Carers Resource. So we thought before we start, we'll just give a brief overview of Carers Resource and the services that we offer. So we're the local specialist carers centre for Bradford District and Craven, and we also cover Harrogate and Selby, offering support to unpaid carers by giving tailored one-to-one support, information, emotional and practical help to unpaid carers, and also to those in need of care and support through other services. So anyone who's caring unpaid for a friend or relative can request support from us, and this includes young carers from the ages of 5 to 18. So I think for the purposes of this presentation, because Mary and Jane have already spoken about how they support adult carers of people with SMI, we thought we'd take it from the angle of young carers under 18 and the impact and how we support them. So just move on to the next slide. So just thought a brief overview about who is a young carer. So basically, young carers help to look after someone because they have an illness or disability, they experience poor mental health, or they may use drug or alcohol. As I said earlier, the services that we offer run from the ages of 5 to 18 in Bradford District. The young carers that we support, some of them will do a lot of physical tasks, such as cooking and cleaning, or helping someone take medicines or get washed. And then some young carers don't necessarily do any of those things, but they do spend a lot of time worrying about someone. They might be staying at home to be with someone, providing that extra bit of supervision or keeping an eye on someone. And we provide a range of support to help young carers. It's all done on an assessment when young carers first come into us, where we look at what a young carer is doing, but also how the care and responsibilities are affecting them, and depending on how that assessment, we're then able to offer a tailored service according to the level of needs that those young carers have. So that can include trips and activities, youth clubs which take place every week during term time, and then also one-to-one support for young carers which takes place generally in schools, and that's all done with the consent of the parents. The service overall is designed to support young carers' well-being and resilience, and to help them achieve their potential as successful, happy adults, so that they feel supported in their caring role, and that they can achieve as much as they can achieve. So I'm going to hand over to Helen now, who's going to talk a little bit more specifically.
Thank you, Rachel. Yes, estimates vary wildly, actually, for how many young carers there are, depending on whether you look at the census or you look at the BBC. One of them was about 5 times as many as the other. There's probably around 750 young carers. They talk in terms of about 1 in 10, which translates to sort of 10,000 young carers around the district. And it is estimated in the UK that there are 50,000 young carers caring for someone with mental illness. It's also the case that up to 50% of mental health service users have got dependent children, and we, as a service, I would say that's one thing to say in this kind of forum. You know, please do notice when there are dependent children, and not just think of young carers as doing those things Rachel mentioned about cooking, cleaning, whatever. It is about the impact that an illness is having on the family and the parenting capacity and things like that. So if maybe one of the children is kind of stepping up and doing additional levels of parenting for the other children, things like that, all of those things are part of our service of what we see in young carers. We're currently supporting 981, to be very accurate, young carers in Bradford. And as you can see, a large proportion of those have listed mental health as one of the issues that they have. It might not be the only one. It's often combined with another disability or something. And it will only be a small proportion of those who have a severe mental illness. I couldn't easily pull figures off for that from the way we had things. We're in the middle of some essential maintenance on our database, aren't we, Rachel? Just stressing us all out. So we definitely have a lot of young carers looking after somebody with poor mental health, and it's one of the more difficult ones to get referrals through sometimes. Parents, we do have to work, because we work in a kind of a whole family way when we're doing intensive work. So we're either trying to work with the whole family, or we're doing peer support groups, trips and activities. Either way, we can only do that with the parents' consent, because we need to either be able to work with the parent, or the parent needs to know where the child is with us. So that can be a little bit of a barrier with some parents who don't want to feel that their child is a carer for them. It's that word again, isn't it? I think we'll, you know, you struggle with the word carer, a lot of people do. Can I get the next slide? So more statistics that the young carers, as I say, the young carers in families experiencing SMI more likely to be hidden than, you know, they're less likely to have come to us. Schools might not know about them. All of the kind of the bit of the stigma thing that we're all trying to break through around mental illness does affect identifying those young carers, and those young carers are also less likely to put themselves forward and identify themselves within school and things due to the stigma around that. There's also evidence to suggest that if you're a young carer of someone with SMI, that person is less likely to be getting treatment and support than if you're an adult, and that makes sense when you think about it. You know, the young carers, that person might need somebody advocating to get the support they need, and the young carer is less likely to know how to do that or what, you know, who they should go to than an adult who's trying to help. So that kind of makes sense. And yeah, as I said before, we get quite a lot of self-referrals as a overall service, but we get very few from parents who have SMI asking for support for their children. Thank you. So actually, specifically looking at Ramadan, our group support, so while young carers are less likely to attend groups during Ramadan, the one-to-one continues, so we can still see young carers at that time, but that's with a relatively small proportion of the young carers that we're working with. What it kind of means is that we need to think ahead of Ramadan. So we need to be making sure the discussions and things are, you know, we can just be talking generally, you know, are you looking forward to it? Have you got any plans? So that we can pick up on any young carers' concerns in advance in those settings. And then because the workers are always available to kind of go off and have private conversations, we've got that facility to kind of reach out to more young carers than those who are just having the one-to-one. And we find that, you know, what it might be, I spoke to one of our team members, she was a young carer for a parent with SMI herself and is a young adult carer now, and she talked about the effect of that during Ramadan for her family. And she was saying that while you know there's exemptions, and I think Mary said the same thing, although the exemption exists, a lot of people don't want to take that up. A lot of people want to join in. So and sometimes with the differences with medication and stuff, that can have an effect. But Sabia also said that her experience, I think her parent did tend to not fast, but still was affected. So it was destabilised, I suppose, by the change in routine in the house and in the rest of the family. So it still had an effect, even though she wasn't fasting. So I think it's about the concerns that that would be raised to us would be that that they're very attuned. The young carers are very, very attuned to the parents' mental health, and they as soon as they start to see slight changes, they can get very worried and they can think that it's going to escalate. So it's about making sure they've got the right people to talk to if they see that happening. I've put on the slide, have a safety plan, and that's, I don't mean anything formal or kind of dramatic. I just mean that we've had those conversations saying, and what would you do if you started to get worried about dad, or if you started to worry about mum? Who is there that you can talk to? Who else in the family understands? Or do you know the worker? You know, depending on the age of the young carer, but just making sure that they've got, because we're not a 24/7 service, they can't sort of message us, you know, 10 o'clock at night if they're worried. So just trying to make sure that they've got the support networks around them for when those concerns start to happen for them. Yeah, so just our contact details. Please do refer young carers to us. We will we'll do an assessment on any young carer who's referred. They all get quite a lengthy one-to-one intervention with a young carer worker, doing that assessment, looking at the impact, signposting to other services if those are relevant as well. So yeah, and we'll do our best to support. Thanks, Sasha.
Brilliant. Thank you. Thank you, everyone. I think I was just really struck from that one about in that planning, just like sort of we've been talking a lot about people who want to fast or are fasting, and how that's been supported in the last 4 webinars. But also, I think you raised an important point about just the change in routine and the impact that can have on people, and how that's supported through this. And again, through both of your presentations, what really came through is just that element of dialogue that needs to happen in terms of planning, of talking about it, being open to talk about Ramadan, what that means for the person, and what planning can happen, and how that's done in partnership with families and the person as well. And that's just really important. I wonder if there's any questions that we've got from people who have joined in, and if people want to turn on their cameras now, if as we hear questions from people, or any reflections that people have. In terms of Nicholas, your question about supporting people who have an eating disorders during Ramadan, there's some really interesting tips and resources that will be available on the website if you go on there, but also the discussion that took place in webinar 2 really goes into some of the clinical aspects of supporting people who have an eating disorder, and that is about that planning preparation, that dialogue, and understanding the change of routine and what that has on a young person who might have an eating disorder, or an adult who has an eating disorder. So the webinars are recorded, so the webinars you can listen to the webinars as well as the slides, so they're both available on that, so that they're there to look at. Any questions or reflections from anyone? I wonder, even amongst yourselves, Helen, Jane, Mary and Rachel, are there any reflections you've had from listening to each other in terms of the work that you're doing with carers?
I think with, as you said, with both presentations, where it's that person-centered thing that has to come through, doesn't it? Because there's such a variety of issues that you might be thinking about, and I think with our group work, I think it's really good. It's kind of brings a new element by saying, right, well, ahead of all kinds of different festivals, we should be talking about it. You know, it's educational, you know, as well as the young carers find all that kind of stuff really interesting, and learning about each other and learning about different cultures and things. So it's really, I think it's really useful for all of the young carers that we do that, and not just those who are directly affected by Ramadan. And it helps them to support each other, that they understand what's going on.
Yeah, and I think that whole element of what we learn in terms of how we support people before the month of fasting are probably the same principles and approaches that we take when we support people through the festive period at Christmas as well, and or through Lent for people. So that there are things that we learn, and I think this is something we've really wanted to focus on this year, in terms of how we really bring together our whole partnership to be aware of doing more during this period. I know amongst staff members, one of the things that we're absolutely being really upfront and forefront around is how we prepare staff members who themselves will be fasting, and that support that we provide for them, the flexibility in their work, just even staff members all fasting in solidarity and doing that, and we're doing a few partnerships with the Big Iftar and some other partnerships with Islam Bradford as well to really bring that sense of community into how we work. So, some really good practices happening. I know our social work team are also planning a series of just awareness raising activities that they want to do with their service users who might be in their homes and within care homes as well. So some really exciting conversations that have happened as a result of these webinars that I've got people thinking about the month of Ramadan well ahead of the month of Ramadan, and we're probably just less than a month away from. In fact, I think we're exactly a month away from the start. So gives people a lot of time to plan. If we've not got any more questions, what I might do is bring this to a close there. Again, I'll just give people a moment or two to see if there are any further questions. But if not, as I said, the website is available where the webinars themselves are all recorded and uploaded there. We've got some resources there and links to resources that are nationally available that both medical and the British Islamic Medical Association have recommended to access, and that's for a range of support needs. And so they're all available on www.bdcpartnership.co.uk. And if you go to preparing people with serious mental illness for Ramadan, that will be where all those resources are located. But there's a range of other things that you can look at in terms of the work that we're doing in Bradford for people with SMI. And healthyminds.services, www.healthyminds.services is where all our public facing services are available for people to look on, and you can find out how to access carers resource and making space through that website as well. Just see that. Yep, thank you, Masira. That's a really lovely comment. So Masira said, I'm really pleased to hear how we're working to become truly person-centered and understanding how our mental health is affected to such a degree by holistic matters such as spirituality. And it is that element of how do we see people as a whole, and living to what we've agreed with our communities and frontline staff about better lives for people, and better lives are about understanding the whole person and not just the mind and the mental illness. So want to thank you, Rachel, Helen, Mary and Jane, for giving your time and talking to us about the work that you're doing. And thank you for everyone who's joined us. Please do check out the resources. Have a safe day today. The snow's coming down fast and thick, so hope you're all able to get home safely if you are in the north. And I can see we've got some people from across the country who've joined us. So yes, thank you for joining us. Take care, everyone. Bye-bye.